So we did recently publish a little bit of our own experience utilizing PD-1 inhibitors following failure of our bispecific CAR T in patients with relapsed refractory B-cell malignancies. And so as many of you may be aware, we have an anti-CD19, anti-CD20 bispecific CAR T that we use in our trials in-house here at the Medical College of Wisconsin. And so there previously has been some data published on the use of PD-1 inhibitors following failure of CAR T therapy. Not a ton in the literature currently, although we're hoping to publish more data on this, on the use of PD-1 inhibitors following CAR T failure. But there was some data suggesting that this may reinvigorate the CAR T cell and may lead to improved responses following CAR T failures. There were two of our patients in our bispecific CD20, anti-CD20, anti-CD19 CAR T cell trial who maintained very high levels of their CAR T cells following CAR T failure. And so we postulated that in these patients, we might give that perhaps by giving them Pembrolizumab, we might reinvigorate their CAR T cells and lead to sustained response following their failure. And so two of these patients, we gave Pembrolizumab 200 milligrams IV every 3 weeks to. In one patient, we did see that they had relatively high levels of PD-1 expression, which decreased following anti-PD-1 blockade. And they did have a minimal response, not quite a partial response, initially followed by progressive disease afterwards. And another patient, we saw similarly, levels of PD-1 went down as expected. However, despite this, they had progressive disease on it. And so at least for our own anti-CD19, anti-CD20 CAR T cell product, we believe that there likely isn't a significant role for PD-1 blockade following CAR T failure. Although there still needs to be more data published on this in the anti-CD19 CAR T cell realm, of which actually we are trying to currently publish our data on this in another multi-center retrospective cohort where we a large population of patients who received anti-PD-1 inhibitors following CAR T failure in the first-line setting with similar results seen previously. Not the best responses, but more to come.